Hello, good afternoon, everyone. My name is Shane Hamstra from RTI International. I will be your technical host for today's webinar. If you have any technical assistance issues, please go ahead and let me know in the Q&A pod on the lower middle of your screen. Also, the Q&A pod is a great place to put in your comments and questions for today's presenters. As we go along, we will collect those questions for the end Q&A session. However, I will answer your technical assistance questions as they come in. So without further ado, I'd like to hand it over to today's moderator to start the event. Thank you very much.
Thank you, Shane. Good afternoon. Let's go ahead and begin our webinar. Welcome to the webinar today on writing an effective work plan and evaluation plan, facilitated by the National Alzheimer's and Dementia Resource Center, which consists of our team at RTI International. I'm Sari Schumann with the Resource Center team, and I'll be moderating our webinar this afternoon. The purpose of this webinar is to provide helpful, current, and applicable information for your ADSSP and ADI-SSS grant projects. Please note the webinar today is being recorded and will be archived at nadrc.acl.gov. The PowerPoint presentation and other materials will be sent to attendees after the webinar. We will allow time for questions through the webinar's chat feature at the conclusion of the presentations. If you have a question during or after the presentations, please enter those questions into the chat feature. At this time, I'd like to turn it over to Erin Long from the Administration on Aging, Administration for Community Living, to provide a brief welcome.
Hi, everyone. I want to thank you for taking the time out of your schedule to attend this webinar. I'm very hopeful that it will provide you with assistance in working through our planning phase process to get your work plans and your evaluation plans in a condition that we will be able to move you forward to the implementation phase, but will also serve you well as you initiate the activity on your new project. I'm not sure if I'm supposed to start going ahead now, Sari, or do I give it back to you?
I can give a quick bio for each of you, and then we'll turn it back to you. So thanks so much, Erin. Today we'll hear a little more from Erin Long and Liz Gould and Stephanie Hughes as well about writing effective work plans and evaluation plans. As you may know, Erin Long is the Aging Services Program Specialist with the Administration on Aging within the Administration for Community Living. She's the team leader for AOA's 2 grant programs dedicated to persons with Alzheimer's disease and related dementias and their caregivers. In addition to being responsible for the planning and development of the programs, she provides programmatic guidance and oversight for all program activities, including the National Alzheimer's and Dementia Resource Center. She holds a Master of Social Work degree from Virginia Commonwealth University in Richmond, Virginia. We also have Stephanie Hughes, who is a research public health analyst through RTI International with the National Alzheimer's and Dementia Resource Center. She has 11 years of experience in Alzheimer's disease and dementia services and program evaluation. Stephanie serves as the lead liaison for 11 Alzheimer's disease supportive services program and Alzheimer's disease initiative grants. She contributes to the development of papers and resource materials for the Resource Center and leads the analysis and reporting of aggregate quantitative and qualitative grant data. Liz Gould is co-director of the National Alzheimer's and Dementia Resource Center at RTI International. She has 26 years of experience in program development, management, and clinical care in geriatrics and dementia. She directs the day-to-day activities of the Resource Center, including technical assistance for Alzheimer's Disease Supportive Services Program and Alzheimer's Disease Initiative grants, monitors completion of deliverables, and coordinates progress reporting to the Administration for Community Living, Administration on Aging. So with that, Erin, I will turn it back over to you, and you can get started with your presentations.
Great. Thank you so much. As I look at this list of folks, I see that we have a very broad range of veterans and new grantees. So I'm hoping that each of you will get something valuable from this, spending your time with us today. So many of you we've already spoken with. I just want to go real quickly over a cooperative agreement. I know that We're all super excited to get you rolling on this year's programs, and we just want to remind you that these are cooperative agreements, which is a little bit different from what some folks are used to, which just a standard grant that we give you some money and we say, go do some great work and come back and tell us what happened. The way it works with cooperative agreements is that we do have substantial involvement throughout the course of the grant term. And essentially what this means is that we'll be involved during the planning phase, and that's when we're going to work on these work plans and evaluation plans. And then we will, in addition to your reporting, we'll check in with you from time to time to assure that we're on track and we all understand what you're doing. But it's really, the cooperative agreement is definitely a communication exercise to ensure that we're all on the same page. So I mentioned the planning phase. The planning phase of the project is, as it was laid out in the work and the funding opportunity announcement, is intended to be the first 6 months of the project. Some people do get through the planning phase in 3 or 4 months, and some people take longer. So, but our goal is to, somewhere around 6 months, and using that time to flesh out all of the details related to the work plan and the evaluation so that we get off to a solid start and everybody knows the steps that are going to be taken. I think it's important to recognize that we do understand that during this planning phase that everybody has 60 days to put these applications together. Times may have changed, situations, you may have gotten more information and want to make some adjustments to what you originally submitted. That is the purpose of this time, to make accommodations for what's happened within the last 8 months since you submitted your application. So you may have learned something more that you want to put in there. We can't change your project completely, but we certainly can make adjustments to make it more efficient and more effective. And during this planning phase, you will only be able to access the 15% of your grant funds, so it behooves you to let's get through it so that you can access all of your money. Once we have agreed that your work plan and evaluation plan are suitable to both you and to us at ACL, I will then signal to you that we're going to approve. You will put both of those documents into Grant Solutions, and I will put notes in there stating that I've approved it and that you're set to move to the implementation phase. And with that the door will open for your access to the additional money. And again, I just want to emphasize that we understand that too, that as the project goes on, if you learn something isn't necessarily working for you and you do need to make adjustments over time to your plan, that is absolutely acceptable. So again, not too much, but for sure we can adjust as time goes on. And that is my spiel, and I will turn it over to Liz.
Thank you very much. This is Liz Gould, and I'm very glad to be here and talking with you on this very important topic. Earlier this year, the Resource Center team came up with the idea of doing a webinar and creating the materials which you will receive afterwards to help the grantees, the new grantees, get through the planning phase, as Aaron talked about. We've seen that there have been previous grantees that have gone through multiple drafts of their work plan before getting final approval. So our goal today is to provide you with the information you need to get through this and to write an effective work plan and evaluation plan. So I will cover the part of the presentation today on work plan components, and then Stephanie Hughes will talk about the evaluation plan piece. So we have on your screen the work plan components, and we've broken it down to include the project goal, the objectives, the activities that are tied to those, the tasks, and then each of those should have a lead person and the timeline outlined, so the amount of time, what months, all of that. So what we know is that a lot of times most projects include between 3 to 5 objectives, and then those objectives should tie to the overall project plan and the project goal. And the activities would be planned in support of each objective. So you may have one or more activities planned for each objective. For example, if the objective is to address the needs of persons with IDD and dementia, one activity might be training your own organization staff in IDD, or another one might be presenting a session on IDD and dementia at a local conference for physicians. Only include activities that are being funded through the grant. Other existing or planned activities that relate to the grant but are not supported through the grant or through match funding should not be included in the work plan. And we include all of these tips and these parts in a tip sheet that you will also receive, because I know that I'm going to cover a lot of specific details today. For the tasks, you'll want to then list the steps that your project team will need to take to plan and execute each activity. It may make sense to list these in chronological order. So you're going to be meeting with the steering committee before coming up with the plan for doing what you will be doing. I'm just coming up with that example. For the lead person, you'll want to list one member of the project team who will be the point person for each task. Then within the task description, the grantee, you can clarify the roles of partners. And then for the schedule, all 3 years of the project would be shown, and we provide for you a template that you can use, and that will be, it's available both in Excel and in Word format. But the tasks would be laid out by month. For the task details, I'm going to go to the next slide. For the first thing, your tasks should, in the work plan, should cover the details of how your project will be carried out, including the development of contracts with partners, as those are applicable, how participants will be identified, how services will be marketed, your outreach plan. You'll want to name specific curricula or training that will be or is being used as that applies. You'll want to be clear about which aspects of the project are intended to meet the requirement for evidence-based or evidence-informed interventions, as those are defined by ACL. You'll want to include available specifics of how, when, and where services or programs will be delivered, the schedule of regular meetings or communications with project team and partners as those apply, any staff training or protocols that need to be developed to carry out the activity. You'll also want to include outputs and outcomes for each activity and how those outcomes will be measured. This can be included in the work plan, or you may decide to do a separate evaluation plan, and Stephanie will go through that in a bit. You'll also want to include the plans for building the systems and the funding that you would need to sustain each activity after the completion of the grant. This may include things like meetings with project partners to explore options for funding and those sorts of things. As a reminder, the projects, both ADSSP and ADI grants are required to include an intervention that meets ACL's definitions of being evidence-based or evidence-informed, and be sure it's clear in your work plan which activities are intended to address this requirement. So just want to make sure that's very clear. So I'm going to go to the next slide. So now we want to just provide some tips on writing an effective work plan. Firstly, spell out the words or names the first time that they're used within a work plan. You may also want to include a glossary at the beginning or the end of the work plan so that we're clear about what you are referring to in the work plan. Be specific. That is the biggest issue that we've seen, is just having the specifics is really key. So for example, if it's an activity, instead of saying train caregivers, you would say train caregivers in behavioral symptom management using the Savvy Caregiver program. Instead of saying for the lead person, project staff, partner staff, that's not as useful as writing the person's specific job title or their role, their organization, and then whenever you can, include the person's name. Also, for time allotment, you want to be sure to include the time that you need. A lot of times we may see that there's not enough time allowed. So include the time you need, say, for developing the contracts and executing them. Typically 1 to 2 months is not enough time. Include time for the planning phase. Include time for training staff on how to administer the data collection, and also training staff on data reporting. And then what you will want to do once you come up with your draft is ask someone who's not familiar with the details of the project to read through it and provide comments about things that may not be as clear. Maybe things need more specifics, or they feel that, gosh, is that enough time to complete that task or that activity? So we thought we'd just go through a couple examples. So let's take the sample objective of provide effective care, supportive services to persons living with moderate to severe impairment from ADRD and their caregivers. So that's our objective. Now I'm going to go to the next slide, which will be an activity. And this would be train agency staff on dementia and care planning. Then tasks that would fall within that would include things like identify dementia training for staff to include 3 sessions on dementia basics, effective communication, and care planning. The next one would be develop pre-post evaluation to assess change in knowledge and change in attitudes. Another task would be something like conduct agency-wide training during an annual 2-day staff retreat. And then another one would be train new hires and conduct refresher trainings every quarter on those topics. So you can see how things are more specific. And then each task will include a lead person and be scheduled on the timeline. One of the materials that we developed for you to reference is a sample work plan. So we kind of made up a grant and came up with the objectives, the activities, the tasks, just so that you can see how things fall within that. Another example is we can look at some sample objectives, what was an original and then what was the rewrite. So for this particular one, assist people with dementia in remaining at home and provide caregiver support. That's not as helpful as the rewritten one, which is assist people with dementia to remain independent at home by providing them. So you provide the goal is to help them remain independent by providing them with home and community-based services. And then a separate one is provide caregiver support through respite services and caregiver training. Then for a sample activity, the original was provide respite services, and the rewrite is provide respite services to caregiving families in these counties, Forrester and Omni counties. Sample tasks, identify and refer families for respite program. First, you need to develop the criteria for that. So that would be one part of that task. Then another part of the rewrite is to identify potential participants from, however you would do that. And then the third would be screen and enroll in interested participants. So you can see how that is much more specific and detailed in the rewrite as compared to the original. What we have developed and you will receive after today's presentation, we have a template for you to use that's in both Word and Excel. We have a tip sheet. We also have a sample. And as Sari talked about, this webinar will be archived. So for those of you that have others on your team, that is something you can refer them to. And then we also have other resources, such as the training resources compendium. This is a compendium of resources that we've put together that you can draw from when you're thinking about training the professionals that are involved in your grant. So that's just one piece that may be available to assist you. So at this time, I will turn it over to Stephanie Hughes.
Thank you, Liz. Hi, everyone. This is Stephanie Hughes from the Resource Center. I'm going to talk with you a little bit this afternoon about the evaluation plan piece in terms of what to include in your evaluation plan and how to document that plan. So all work plans do need to include details on how you're going to evaluate your efforts, but there are a couple different ways that you can go about documenting these plans. First, you can incorporate the evaluation elements into your work plan document. And if you go this route, then for each activity you engage in, you would need to include separate tasks that describe how you will evaluate success. A second option, and one that may make it easier to track the details of your evaluation, is to create a separate evaluation plan document. So either way is okay. Some of you'll also want to let us know who is taking the lead on your evaluation. Some of you may be contracting with an outside evaluator to help develop your evaluation plans, which is fine. If this is the case, you'll want to be working closely with that person to not only think through the plan together, but to make sure that all of those necessary components are included. So what are those pieces? So your evaluation plan starts with the same parts that we talked about in the work plan, your main objectives and then the activities that you'll do to meet those objectives. So that part will be exactly the same as what's in your work plan. Then for each project activity, you'll want to provide details on your outputs. This is where you give us an idea of how many people you're going to serve, how many trainings you're conducting, et cetera. So basically a count. You'll also want to give us information on your outcomes. And you can think about this in terms of what you expect to change as a result of the activity you're doing. So it could be an increase in staff knowledge. It might be a decrease in caregiver burden. It might be a more efficient system of referrals. And you might have one outcome for a particular activity, or you might have a few outcomes in mind. You'll also want to indicate how you're measuring these outcomes. And these are the specific tools that you can use to measure your outcomes. They might include things like questionnaires, patient medical records. So basically, how are you going to measure whether these outcomes actually are accomplished? And we'll talk about some resources for where you can find evaluation measures. So there are several issues to consider in terms of data collection as well. Who's going to be collecting the data? Does that person or do those people need to be trained? What's the schedule for when you're going to be collecting your data? How will it be collected? Are you going to collect it at the time of service? Are you going to collect it after the program is over through a phone interview? So thinking through some of those details. You'll also want to think about data quality. how are you going to maximize response rates and make sure that you have a large enough sample for your results to be meaningful. So in today's call is sort of beyond the scope of what we're looking at to cover all the aspects of evaluation, how to do that. We will provide you with some other resources, but these are all pieces to be thinking about for your evaluation and that you'll want to include in your planning documents. Data analysis and reporting, who's going to be tasked with making sure that the data is good quality, with analyzing it, with reporting on it, and how are you going to do that reporting? On to some other tips and examples. Just a quick word about what evaluation is not, at least for these particular types of projects that have been funded. As you probably know, these grants are not intended to be research projects. You don't need to be setting up a randomized control trial or anything with that level of rigor. The idea is that you're probably planning to deliver programs that have already been demonstrated as being effective rather than researching new interventions. At the same time, though, your evaluation plans should go beyond just counting how many people you served or collecting satisfaction surveys. So we want to see kind of a happy medium there, where that's a little bit more rigorous than just looking at outputs, but it's not to the same standard as if you were doing an academic research project. Just a few tips in terms of how you approach your evaluation. There are many good validated measures that already exist that you can use in your project. And there's a few benefits to using these validated measures. For one thing, it saves you time. You don't have to recreate the wheel and spend time developing something new. Validated measures have already been tested to show that they do measure what they're intended to measure, which isn't always the case when you develop a new product. And finally, by using something that's standardized, it may be easier to compare your results with other projects that have used the same measures. Where possible in your project and where it's reasonable, do try to build in some pre- and post measures. If it's a really brief session, like a community education session, then perhaps a simple post-evaluation or satisfaction survey may be sufficient. But if you're delivering a more in-depth intervention or multi-session training, then a pre-post measure may be more appropriate. Low response rates can make the data that you've collected much less meaningful because if you don't get a high percentage of people providing you with data, then you don't know whether the ones that did respond are really representative of all the people that you served. So it is important to be thinking through how to get a good response rate from your program participants. And this can get to be especially tricky if you're doing things like collecting data over the phone or through the mail. So you want to just be sure to think through that piece about how you're going to maximize your response rates. Another thing is just think about each piece of your project and what you're trying to accomplish with it. You all know that there is certain demographic data that you're required to collect about people with dementia and caregivers who are served. But beyond that, for certain pieces of your project, it may make sense to look at outcomes other than participant-level outcomes. You might want to look at something like a new referral system and whether that's being implemented. And there may be other sources of data other than participant data that you want to work with. So think about each piece of your project on its own. What are the goals and outcomes that you're trying to get to, and how can you best measure those? So we'll just take a look at an example here. In this case, our objective is to deliver behavioral symptom management training and expert consultation for family caregivers. And the activity that we're going to do to support that objective is to conduct savvy caregiver workshops. So in this example, the output is the number of workshops we're conducting and the number of participants for those workshops. We're planning to hold 5 separate savvy caregiver sessions in different communities. We're estimating that 15 people will attend each session for a total of 75 attendees. So that's what we would indicate for our outputs. Continuing with the same example, as we move on to looking at outcomes and outcome measures, in this case, you might have a few different outcomes that you're trying to target. In this case, we're looking at increased caregiver self-efficacy or confidence in the ability to be a good caregiver, decreasing caregiver depression, decreasing caregiver burden, and perhaps by extension then improving the quality of life for the person with dementia. And so we're also showing here in parentheses some specific outcome measures that we might use to measure those outcomes, such as the revised scale for caregiving self-efficacy, or in the case of depression, we could use something like the PHQ-9. So these are well-established measures that have been tested and that are that many grantees have used in their projects before. So again, some example of language that you might use. If we're talking about outcomes, in this case, we might say our goal is that caregivers will be able to cope with caregiving and will help the person with dementia remain at home longer. Well, that's a great outcome to aim for, but we might rephrase that to be a little bit more specific. Actually, I'd probably revise what I wrote here and say that the revised outcome is to improve caregivers' burden as measured by the Zurich burden score, and that caregivers will be less bothered by behavioral symptoms as measured by the revised memory and behavior problems checklist. So we've got something that's really clear and quantifiable and tells us how we're going to measure those things. Now, in some cases, depending where you're at in your planning, you may or may not already know all of the specific measures that you want to use, and that's okay. If you're not sure yet which measures you plan to use, you can include that in your plan and say, you know, our next step is to review potential depression screening measures that are available in both English and Spanish that, you know, are short enough to use in the intervention that we're conducting. So it's fine if you want to put that in your planning, that you're going to select a measure as part of the process. Moving along with our example here, we want to look at who's conducting the evaluation. In this case, the evaluator is going to be actually doing the assessments of the caregivers. We're documenting here how and when the data will be collected and including that in our plan. So in this case, we're collecting data at baseline, right after the completion of the workshop, and then again 6 months later to see if any of the benefits have persisted. And then we're also showing that we will be analyzing the results first after the first session to see how the workshops went, perhaps reevaluate if anything needs to be adjusted. And then after that, we'll be reporting the results semi-annually to be included in the required ACL reporting. So that's just one example of what that documentation of your evaluation plans might look like. For some of you, again, this may be old hat. This may be something that you've done a lot of and you're very familiar with and comfortable with. For others, evaluation may not be something that you have worked with as much before. So we do have staff with expertise in evaluation that are available through the Resource Center to help you. We can meet with you individually if you like, and we can help you with really any aspect of your evaluation plan, from identifying outcomes, identifying outcome measures, figuring out how to collect data, how to analyze it, how to make sure that you've got quality data, how to clean the data. So we're glad to talk with you through any of those aspects of your planning. If you would like to schedule a one-on-one consultation, please reach out to your technical assistance liaison at the Resource Center, and we are glad to set that up for you. Going along with what Liz talked about, we've also created some resources going along with our presentation today. So we have, in addition to the work plan templates, we've put together evaluation plan templates, both in Word and Excel format, depending on which program you're more comfortable with. Same information in both, it's just a slightly different layout. So we will be sending those to you as a follow-up. We also have a sample evaluation plan. If you decide to create a separate evaluation plan document, this is an example of kind of what level of detail you would get into, what information to include, and it goes hand in hand with the sample work plan that we've put together. So you can see the carry-through from the activities that are documented in the work plan and then how those carry over to evaluating each of those activities. The Resource Center has also put together a resource list of evaluation measures. It's not all-encompassing, but it includes many of the outcome measures that have been commonly used for assessing persons with dementia, family caregivers, and professionals. So measuring things like knowledge change, burden, quality of life, functional status, depression, et cetera. And what we've really tried to do is take some of the work out of your hands so that you don't have to go searching for these measures. This list shows you where to get them, gives you some sample questions, tells you how to obtain permissions to use it if that's necessary for a particular tool, tells you if the tool is available in other languages, and some other related information. So that is available through the ACL website. There's a link here in this presentation that will be sent out to you. We also, the Resource Center, did a webinar last year on evaluation that goes into a lot more detail on the components of a good evaluation and how to think about that. So that's another really great resource to draw on if you're looking for some other specific help with evaluation. So I'll just recap here quickly and then we can move on to question and answer time. So again, work plans do need to be approved to move to implementation phase. Again, being as clear and thorough as possible in describing your plans and being detailed. Usually more detail is better than less. The evaluation plans can be part of your work plan document or separate. Please do refer to some of these resources that we've provided. I think you'll find there's a lot of good information there. And we are available to help you and are glad to help, so please call on us as needed with questions and with any support that you might need as you're working through these plans. So that covers our presentation. So Sari, can we move on to question and answer?
Yes, so as you'll see, the layout of your screen just changed so you can enter questions in the chat feature. And while you're assembling your questions, you can also note in the closing notes below the National Alzheimer's and Dementia Resource Center website. That address is listed, nadrc.acl.gov. A number of the resources that Liz and Stephanie mentioned are available on that website. You can also send feedback or questions about the webinar to myself or Erin Long. And the email addresses for Stephanie Hughes and Liz Gould are included in the closing notes as well. So we welcome your questions about work plans or evaluation plans. And as those questions get assembled, I'll let the speakers add in any pieces of information that they may have passed over due to time. Erin, Stephanie, Liz, do you have any other comments you want to make while folks are assembling their questions? And if not, we do have a question about when an evaluation plan is due. And Erin, if you could just talk a little bit about how the kind of due dates for things are structured, that would be really helpful.
I think that there's no hard due date on the evaluation plan. What we like to see is out of the gate, your project reflecting working on the evaluation plan and understanding the steps that it takes to develop an effective evaluation plan theoretically as you're prepared to launch your program. That would be complemented by having a solid evaluation plan in place. We will approve your work plan with the steps of the evaluation plan included in it, that gets to the measures and the outcomes and things in it. But I would hope that your evaluation plan would be in place before you're actually providing services, so that you will be able to, you will have all that would indicate you would have all the tools ready to execute your evaluation plan with the services. Liz or Stephanie, do you have anything you'd like to add to that?
No, I think that covers it well. Essentially, you do want to have that in place before you start to offer services, and you may actually want to include in your timeline to do the baseline evaluation so that you can see where there's change over time from the work of the grant.
Great, thank you, Erin and Liz. So if you do have questions, you can enter them into the question and answer chat feature. And I will also just allow Erin, Liz, and Stephanie another opportunity if there's anything else you want to comment on that came to mind during the presentation. That this is a great time.
This is Liz. I just want to put in a plug for the contacts that each of you have. We have through the Resource Center a person that is assigned to your grant to provide the technical assistance, so that along with Erin, that person or your project officer who's assigned to your grant, that person can provide some support and can also help to link you to others on the team who may have specific expertise such as evaluation. So we can be sort of a gateway to you for your technical assistance needs.
Great.
Yeah, and this is Erin. I would just echo that and say that there are no questions that are too large or too small. Don't ever hesitate to reach out to the Resource Center or to me. And if we will get you the answers, whether we have immediate access to them or if we have to go out and find them. We will always do our best to get you the best and most up-to-date information to assist you in the implementation of your programs.
Great, thanks, Erin. Could you just go through, we had a question come in about the specific steps that should occur once the revised work plan has been submitted to you for review, or the whatever other project officers are on the team?
So once it is submitted, basically what we always ask is that you submit it just by email to the TA staff and the program officer. Once you've gone through the process of reviewing it, by the time you get to submitting something, hopefully it's in shape that we have discussed, and there's likely to have been a couple of iterations of it. And once it is in a state that is we're able to approve, then we would ask you to upload that final document into Grant Solutions, and then your program officer would put a note into Grant Solutions indicating that your work plan is approved and that you're approved to move to the implementation phase. For whatever reason in this system, we cannot put notes in the system, grant notes that you can see. We can see what you put in, but you can't see what we put in. So then your program officer would send you an email with a cut and paste of what was put into Grant Solutions, just so that you have confirmation that you have been approved. It'll, obviously you get an email, it would be date stamped, and then you can move forward.
Great, thank you, Erin. So if folks have other questions.
Stephanie, I was just going to,
Go ahead, Stephanie.
Yeah, I was just going to add to something that Erin said earlier, which was that, obviously the focus of this process is getting your work plan finished and approved so you can start with implementation, but we really hope that this process will also be helpful as you're moving forward and giving you a roadmap, that, there's a lot of time and effort we know spent documenting all of these pieces, and we hope that this will be then a really useful plan for your team going forward to be able to work from. So that's definitely part of the goal in laying all these pieces out.
Great, thanks, Stephanie. So this is one of the last chances you'll have to ask questions if you have any for this webinar, but as we've emphasized, you always can ask questions to your Resource Center liaison and your program officer from the Administration for Community Living. So you can keep that in mind as questions arise, because we are here to answer those throughout your grant cycles. And Erin, Liz, and Stephanie, before I close out, do you have any other final words that you want to say?
I just want to say thanks to everyone for taking the time to attend the webinar. I hope you found it useful, and just again, reiterating that we are here ready to help when we can. All you need to do is ask, and we're super excited for all the different projects that are going on. There's amazing work happening, and we're thrilled that you will be having strong evaluations so that we'll all be able to, it's great for everyone because it will help you in your sustainability, and it will help us at AOA and ACL in our sustainability in making the sometimes we have to make arguments as to why our programs, all of us know why they're so important, but sometimes people up on Capitol Hill need a little reminding. And by us having strong evaluations and strong outcomes, it builds the case so that we will continue to have strong programs and with solid funding, because we really have each year, even though it's in small increments, we really have been on the uptick as far as funding goes, and we certainly want to keep it that way. So I appreciate, and we appreciate all your hard work and commitment to the people we serve, and let's just keep the momentum going with great work and helping all the people that so need what we do.
Thanks so much, Erin. So thanks to everyone for attending today. As I just posted, you will be receiving all the materials via email from me. If you don't receive them, you can contact me via email. And just one more note, if you are interested, we'd love to have you at our January 17th webinar. It'll be on a program in Minnesota related to cultural consultation, and I'll be sending out information about that webinar this afternoon. So take care, everyone, and have a great afternoon. Thank you.